So we are now inside the software after importing both the DICOM data, which is the CT scan. We're seeing the 3D rendering, and also importing the model after it was scanned, and this is the STL file. Both of these models have been merged, and we see it's quite a good merge. And the next step before we start the planning of the implant is to delineate the nerve and also create a virtual wax up. So I'm going to start with the nerve. So I'm going to start by marking the nerve, the inferior alveolar nerve, on the left mandible, starting from the entry point into the mandible along the nerve. And then as I'm getting closer to the mental foramen, I'm going to move to the cross section and create this nerve as it exits the mandible. So this is step number one. Step number two, I'm going to create a virtual wax up, which is quite accurate for a single missing tooth. An actual wax up is more accurate, but this type of wax up is so easy to make and create, and doesn't require additional work and expense. So the first thing that I do, I outline the buccal aspect of the teeth, create the arch, pick the tooth number, and the tooth is obviously not in the proper position. All I need to do is move it to the right position, tooth number 19. It's relatively simple to do. Okay, so I'll go by the buccal contours of the adjacent teeth. I'll look at it from all three dimensions, and very simple to do. And rotate the tooth a little bit, move it a little bit lower, just to make sure that the marginal ridges are same level. Okay, some final adjustments, and we have a virtual wax up. The next thing that I need to do is place an implant in the site, and I'll use the appropriate cross section somewhere around the middle. So I place an implant, and then I can change to the type of implant that I'd like to use for the case. So I'll mark the tooth number 19. I'll specify the implant, and I'll specify the length. And I'm also going to choose an abutment, but not an abutment in the classical sense. I'll use a conical abutment that is 4 millimeters in diameter and 15 millimeters in length. And that is only to show me the trajectory of the implant. So we can obviously see that the current positioning is not appropriate. So for the next few minutes, we'll finalize this position. I like to start with the mesiodistal section, so I can place the implant first in the mesiodistal dimension, and then go back to buccal lingual, make sure that I have enough buccal and lingual bone, and have an ideal screw axis positioning. What I'd like to do is have the mesiodistal trajectory parallel to the contact area. So I'm going to tilt this implant a little bit more, and I think this is a much better position. The last step is to make sure that I have the proper depth, the apico-coronal direction, and I like the implant to be about 2 to 3 millimeters subgingival for proper emergence profile, so we have proper contours and contact areas. And this is done in the cross section. So we have the soft tissue outline. I can measure where it's at right now. And currently the implant is positioned about 2.17 millimeters, about 2 millimeters, which is adequate. Once I'm ready, I can order the surgical guide.